Gentlemen, let me ask you something honest and real. Have you ever been in a moment when you wanted your body to respond but your erection wasn't as strong as you expected? Or it disappeared before you were ready? It's frustrating, even disheartening, and for many men, it sparks that quiet thought, maybe I'm just getting older. Maybe this is how things are now. But the truth is far more encouraging. You are not powerless. While pills can offer short-term relief, real and lasting strength comes from restoring the body's natural ability to perform. There are science-backed exercises that can enhance your blood flow, strengthen your erectile muscles, and rebuild the confidence you thought you lost, all without relying solely on medication. And today, I, Dr. Hannah, am going to walk you through 3 powerful, practical methods that can help you do exactly that. The final one is rarely discussed, but it could be the hidden key that changes everything for you. Before we begin, do 2 simple things. Hit the like button if you care about men's health, and let me know in the comments where you're watching from. It's always inspiring to see how far our community of men committed to better health reaches around the world. And make sure you subscribe so you never miss my weekly guidance on vitality, intimacy, and confidence. All right, let's begin. Before we dive into the techniques themselves, we need to clear up one common misconception about erections, and it's one most men never truly understand. 1. Understanding erections. Let's start by clearing up one of the biggest myths about erections. Most men assume that if their performance isn't what it used to be, it's either because their testosterone is low or something psychological is holding them back. While both can play a role, that's only part of the story. Biologically, an erection is not primarily a hormonal or mental process. It's a vascular one. In simpler terms, it's about blood flow. When you're aroused, your brain sends signals that open up the arteries supplying the penis, allowing oxygen-rich blood to rush in. At the same time, small muscles around those blood vessels relax, and the erectile tissue expands, trapping that blood. The veins then tighten just enough to hold it there until release. That entire process depends on how healthy and responsive your blood vessels are, and how strong the surrounding muscles can support them. If any of these elements weaken, poor circulation, tension in the pelvic muscles, or reduced elasticity in the tissue, you can experience softer or shorter-lasting erections, no matter how much desire you feel. This is why many men get frustrated when pills seem to stop working after a while. Those medications don't fix the underlying issue. They only boost blood flow temporarily. To experience long-term improvement, you need to rebuild the foundation, your vascular health and muscle control. Think of it like tuning up an engine. You can't expect peak performance if the fuel lines are clogged and the pistons are weak. By strengthening the blood vessels and the muscles that control them, you not only restore firmness, but also enhance sensitivity, endurance, and confidence. In this video, I, Dr. Hannah, want you to understand that your body is capable of rebuilding itself. With the right knowledge and consistent practice, you can train your body to perform naturally again, without fear, without dependence, and with the confidence you deserve. 2. Why blood flow matters. When we talk about improving erections, we have to start with what fuels them, blood flow. Every erection you've ever had is powered by your vascular system. It's not just about arousal or hormones. It's about how effectively blood can move through your arteries and stay trapped within the erectile tissue. Picture your blood vessels as flexible highways. When you're young and healthy, those highways are smooth and open, allowing blood to flow freely. But as you age or face lifestyle stressors, like poor diet, lack of exercise, smoking, or chronic tension, those highways start to narrow and stiffen. The inner lining of your arteries, called the endothelium, becomes less responsive to signals that tell it to relax. When that happens, less blood reaches your penis, and your erections become weaker or fade too soon. This isn't just a sexual issue, it's a cardiovascular one. In fact, erection problems are often one of the earliest signs of poor heart health. That's because the penile arteries are smaller than coronary arteries, meaning they show signs of restriction much sooner. The good news is that blood flow can be restored. Your vascular system is incredibly adaptive when given the right stimulus. Regular physical activity, proper nutrition, and specific exercises, like the ones we'll cover soon, train your blood vessels to open wider and deliver more oxygen to your tissues. They also increase nitric oxide production, a natural chemical that helps relax the arteries for better circulation. When your blood flows freely, everything improves: energy, focus, endurance, and of course, erection quality. So before thinking your body is too old or too far gone, understand that better circulation is within your control. You can literally teach your body to respond the way it used to. That's why strengthening blood flow through movement and targeted exercise isn't optional. It's essential. And in the next section, we'll start with one of the simplest and most effective ways to do that: training your pelvic floor muscles for stronger, longer-lasting performance. 3. Pelvic floor power. Now let's talk about one of the most overlooked yet powerful methods for improving erection strength: pelvic floor training. Many men still believe pelvic exercises, often called Kegels, are only for women, but that couldn't be further from the truth. The pelvic floor muscles play a crucial role in male sexual performance, and strengthening them can make a dramatic difference in erection quality, control, and overall stamina. These muscles form a supportive sling at the base of your pelvis, wrapping around the lower part of the penis and surrounding the arteries and veins that control blood flow. When they're weak, blood tends to leak out of the penis too quickly, leading to softer erections or early loss of firmness. But when these muscles are strong, they compress the veins properly, locking blood inside and keeping your erection firm for as long as needed. Biologically, this means better vascular trapping and greater endurance. Emotionally, it brings back confidence. You stop worrying about losing it halfway through intimacy. And practically, it's simple, discreet, and requires no equipment. To find your pelvic floor muscles, try stopping your urine flow midstream. The muscles you activate to do that are the ones you need to train. Once you've identified them, start by tightening them for 5 seconds, then relaxing for 5 seconds. Do this for 10 repetitions, 2 to 3 times a day. Gradually increase your hold time as your strength improves. Within 4 to 6 weeks of consistency, most men notice firmer erections, better control during climax, and stronger sensations overall. Think of it like any other form of resistance training. The more you work those muscles, the better they perform. You can even practice these contractions while sitting at your desk, driving, or watching TV. It's easy, it's private, and it works. By mastering your pelvic floor, you build the foundation for lasting power and confidence where it matters most. 4. Vacuum therapy basics. Next, let's explore a method that's been around for decades but is still misunderstood by many men: vacuum therapy, also known as the penile pump. Some might associate it with gimmicks or late-night infomercials, but when used correctly, it's a medically recognized and highly effective way to improve erectile function. Vacuum therapy works by creating negative pressure around the penis, which draws blood into the erectile tissue. This process mimics the natural mechanism of arousal and helps expand and oxygenate the tissues that support an erection. Once the penis is filled with blood, a constriction ring placed at the base can help maintain firmness long enough for intercourse, but the benefits go far beyond temporary results. Regular use of a vacuum pump actually conditions your blood vessels, enhances oxygen flow, and helps prevent tissue atrophy, especially for men who haven't had regular erections for a while. In clinical settings, doctors even recommend vacuum therapy for men recovering from prostate surgery or dealing with vascular erectile dysfunction. The ideal approach is gentle and consistent. Most men see good results using the pump for 10 to 15 minutes, 2 or 3 times per week. It's not about forcing pressure. It's about training your blood vessels to respond and expand naturally. Like any exercise, form and patience are key. If misused or overpressurized, pumps can cause bruising or discomfort, so it's important to follow guidance from a professional or invest in a high-quality medical-grade device. When combined with other natural methods, Vacuum therapy helps build a stronger vascular response, complementing pelvic floor training perfectly. Emotionally, it offers reassurance. You know you have a reliable tool when you need it. Physically, it increases tissue elasticity, promoting long-term improvements. So, don't dismiss the pump as a novelty. Think of it as a form of physical therapy for your sexual health. Used properly and consistently, vacuum therapy can reawaken your body's natural ability to respond, helping you regain not just performance but genuine confidence and control. 5. Penile traction method. Now we move to a technique that few men know about, but one that has proven benefits for long-term sexual health. Penile traction therapy, also known as the extender method. This isn't a gimmick or a quick fix. It's a clinical approach used by urologists and sexual health specialists to restore blood flow, tissue elasticity, and even penile structure. The concept is simple but powerful. By applying gentle, consistent stretching force over time, traction stimulates the growth of new cells and blood vessels in the erectile tissue. This biological process, called mechanotransduction, encourages the body to rebuild and strengthen itself, leading to firmer, healthier erections. Many men first hear about traction devices in the context of cosmetic enhancement, but their real medical value goes much deeper. Research shows that consistent use, about 1 to 2 hours per day for 3 to 6 months, can significantly improve erectile rigidity, vascular response, and overall tissue resilience. Some men even experience modest increases in length as a side benefit. The emotional impact is equally important. For men who have struggled with performance anxiety or the lingering effects of erectile dysfunction, traction therapy restores not only physical capability, but also confidence and optimism. It's a tangible reminder that improvement is possible through consistency and care. However, it's crucial to approach traction correctly. The goal is gradual progress, not aggressive pulling. A well-fitted medical-grade device should provide gentle tension, just enough to stimulate growth without pain. Rushing or using cheap equipment can cause irritation or injury, so quality and patience matter. Think of traction therapy like physiotherapy for your sexual system, steady, intentional, and restorative. When combined with pelvic floor training and vacuum therapy, it becomes part of a comprehensive plan that strengthens muscles, enhances circulation, and rejuvenates tissue. It's not about vanity or shortcuts, it's about rebuilding your foundation for vitality, function, and confidence that lasts. 6. Combining the 3. Now that you understand each of the 3 methods, pelvic floor training, vacuum therapy, and penile traction, it's time to see how they work together as a complete system. Think of them as 3 gears in the same machine, each one enhancing the others to deliver powerful, lasting results. Pelvic floor training strengthens the muscles responsible for controlling blood flow and ejaculation, essentially acting as the anchor for a firm, reliable erection. Vacuum therapy, on the other hand, conditions your blood vessels, improves oxygenation, and keeps the erectile tissue active and responsive. Finally, penile traction enhances vascular elasticity and tissue strength, ensuring that blood can fill and stay trapped efficiently. When used consistently, these 3 methods create a synergy that targets every major component of erectile function: muscle, blood flow, and tissue health. The best approach is to build a routine that integrates them naturally into your week. Start with pelvic floor exercises daily, since they require no equipment and can be done anywhere. Add vacuum therapy 2 to 3 times per week to keep circulation strong and promote vascular recovery. Then, include traction sessions several days a week, beginning with shorter durations and gradually increasing as your comfort and tolerance grow. It's not about perfection, it's about consistency. Over time, your body begins to respond differently. You'll notice firmer morning erections, better control during intimacy, and greater endurance. Beyond the physical results, there's also a psychological shift. When men commit to this process, they start feeling in charge of their health again. That confidence alone can transform performance, because sexuality isn't just mechanical, it's deeply connected to mindset. Combining these techniques isn't about chasing quick fixes, it's about retraining your system to function at its best. The key is patience and discipline. If you stay consistent, within weeks you'll start to see progress, and within months, you'll realize how much stronger, more responsive, and more confident your body has become. 7. Mindset and motivation. Physical strength and vascular health are essential, but without the right mindset, even the best exercises can fall short. Many men approach their sexual health journey with frustration or fear, focusing on what's gone wrong instead of what can be rebuilt. But the truth is, your mindset determines how your body responds. When you believe your best days are behind you, your actions mirror that belief. You lose consistency, skip routines, and stop expecting progress. Yet when you shift that belief, everything changes. You start seeing every exercise as an investment in your vitality rather than a chore. It's important to understand that setbacks are normal. Some days your results may feel minimal, and that's okay. Progress in men's health isn't always visible overnight. It builds silently through repetition and discipline. What matters most is that you stay committed. Celebrate small wins, better morning firmness, longer endurance, stronger control. These are not just signs of improvement, they're proof that your efforts are working. Remember, your body is adaptive. The same way muscles grow stronger from consistent resistance, your sexual function improves from consistent care. Emotionally, staying motivated also means removing shame. Struggling with erections doesn't make you less of a man, it makes you human. Every man experiences physical changes with time, but not every man chooses to do something about it. By taking charge of your health, you're already doing what most never will. Practically, motivation thrives when you have structure. Set clear goals. Maybe it's performing pelvic exercises daily or scheduling your traction and pump sessions. Keep track of your consistency like you would a workout routine. You'll find that the more intentional you are, the more confident you feel. Mentally, remind yourself why this matters: your energy, your relationships, your self-esteem. This isn't just about erections, it's about reclaiming vitality, power, and freedom at any age. Stay consistent, stay patient, and your results will follow. Gentlemen, your journey to stronger erections and lasting confidence doesn't rely on shortcuts or medication. It's about rebuilding from within. By strengthening your pelvic floor, improving blood flow through vacuum therapy, and restoring tissue health with traction, you're addressing every layer of performance. Remember, your body can adapt, recover, and thrive when given the right attention. Stay consistent, stay disciplined, and don't lose faith in your ability to improve. This is Dr. Hannah reminding you that vitality has no expiration date. With focus and patience, your best years of intimacy, strength, and confidence are still ahead of you.